Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope you will make use of it. My dear friends, already in my playlist, there is a detailed explanation of a history taking in children. Almost all 17 to 18 videos are there regarding the systematic method of taking the history, and that has been viewed by so many viewers, and I have got a feedback that it is excellent and it is quite useful in a day-to-day clinical practice also, especially for the students, scholars. It is quite helpful to understand the proper way of history taking. So this being the case, I thought that there should be also the videos explaining about general examination in children. Now, most of the time we don't know how to take the history taking and also how to do the general examination and what are the points that has to be observed in general examination. So this being the case, I thought that we shall have a series of lectures depending on general examination of the children, so that clinically in the history taking and examination part we will be perfect. So let us start with the new series of general examination in clinical practice. Now in the general examinations, the first point which comes is constitution of the child. Constitution of the child. What is the body constitution? In Ayurveda usually we will use the word prakriti, constitution of the child. Now constitution, it is called as prakriti in Ayurveda, body constitution, and the constitution is there for the body and also for the mind according to Ayurveda. But in the other medical sciences, constitution is also called as diathesis, it is also called as habitus, and it is also called as body type. These are the different synonyms for the constitution. Now based on the body type, humans are actually classified into various somatic types. By looking at their body type, suppose a child is coming to you, by looking at the body type, so based on that human is classified or that child is classified into various somatic types. Somatic means physical, somatic types, bodily types, and this is also called as somatotypes. Now based on this, there are so many divisions are there. Now when we are approaching to the patient, the first thing that we have to identify this, whether this particular bodily features of the child is constitution based or non-constitution based, in the sense, is this particular body constitution is normal to this particular child or not. For that, first we have to understand what are the commonly seen body constitutions, which are also called as somatotypes. The first one is asthenic. Asthenic is also called as hypoasthenic. Asthenic or hypoasthenic. What is this hypoasthenic or asthenic type of body type? So that is thin body. Okay, so they are healthy, actually they are healthy, but thin body, long underdeveloped body with a long neck, and there is a flat chest, there is a prominent hypogastrium, and the fingers are slender fingers. If the body type is like this, then it is called as hypoasthenic or hypoasthenic body type. So the body is totally thin and a long and underdeveloped body with a long neck is there, flat chest is there, prominent hypogastrium is there, fingers are very slender. If you look very carefully, the presentation which is given under the heading of Vataja Prakriti in Ayurveda almost all stands equal with the hypoaesthetic body type. Okay, Deha Prakriti. Among the Deha Prakriti, Vataja Prakriti is one of the type. The Alpakesho, that is the Vatala Chalamanasaha, that means Vataja Prakriti Lakshanas are mentioned, and they are almost all Ruksha, Krisha, etc. So they are all almost all matches with this hypoasthenic type of body personality. Similarly, normoasthenic. What do you mean by normoasthenic? That is a normal range of the body build. It is not too much, it is too less. Okay, it is not too much fat, too much krusha or emaciated, etc. So it's a normal. So then usually we will call that body type as normasthenic. Similarly, sthenic or hyperesthenic is one more type of body type. Sthenic or hyperesthenic. What is that? If the body is broad enough, short, broad, fat content is more, there is a short neck, muscular chest is there, large and stumpy fingers are there. So then that particular body type is usually called as hyperesthenic or sthenic. Okay. So this almost all this explanation matches with the Kaphaja Prakriti. Among the Dehaja Prakritis, Kaphaja Prakriti is explained. It almost all matches with the Kaphaja Prakriti which is explained in Ayurveda. So these are the different somatotypes for your understanding. The first one is asthenic type, or also called as hypoasthenic type. The last one is normoasthenic type. Okay, so it's a normal body figure, whereas in between picnic, it's also called as hyperasthenic type, which is seen in case of Kaphaja Prakritis, or similar to, I cannot say equal, almost all similar features are there to that of the Kaphaja Prakriti. That's called as hyperasthenic Prakriti or somatotype. This is example of hypoasthenic, where see long flat chest is there, okay, and long neck is there, slender fingers are there, arms are very flat, etc. The other type of body constitutions are also there. For example, pesthetic or pithenoid type of, that is also called as tubercular diathesis. Tubercular diathesis, where the exaggerated hypoasthenic, same hypoasthenic type of personality is there, body constitution is there, but it is little exaggerated, as we usually see in of chronic tubercular patients. What we see is flat chest is there, winging of the scapula is there, very lean body will be there, poorly developed musculature will be there. Okay, so he is having more chronicity towards tuberculosis. So usually in tubercular patients we will find this pesthenic type of or pithenoid type of body constitution. Similarly, one more type of body constitution is plethoric or apoplectic. What is plethoric? Plethoric means an exaggeration of the hyperasthenic. See, the first one, tubercular diathesis, is an exaggeration of a hypoasthenic. Similarly, exaggeration of hyperasthenic is a plethoric. An exaggeration of the hyperasthenic type of body constitution with flushed face and florid complexion, protuberant abdomen with a high tendency towards cardiovascular problems. That means more fatty, more obese, or more towards obese, fatty, and too much of fatty accumulation in the body. It is something more than the Kaphaja Prakriti. Okay, that is something more than the hyperasthenic type of body constitution. One more type of body constitution is that is called as athletic. This is a variety of hyperasthenic type only. This is also a type of a hyperasthenic type of a body constitution with overloaded musculature and broad chest. But it is not too much exaggerated, but it is very hefty, and person is very hefty and stout, and the musculature is there, broad chest is there, but is well looking. One more type of body constitution is endocrine. So what is this endocrine type of diathesis? In male type of endocrine habitus or diathesis, individual is there with excessively hairy and virilization. There is more virilization, and person is there with the extra or excessive hairs in the body. While in the female type of endocrine diathesis, there is less amount of the hair, but body structures or skin is very delicate, and there is too much of fatty breast and also too much of boggy buttocks in case of the females. Okay, so that's called as endocrine diathesis. Similarly, one more type is there, that's called as dysplastic. What is dysplastic? This is a mixed constitutional type. Dysplastic means mixed constitutional type, where more than two or more than that type of body constitutions are mixed together. So that is called as dysplastic type. Now, on the basis of anthropometric classification, there are three types of the humans are seen. See, this what we are discussing is in the constitution. This is the first point in the general examination. When you are going for general examination, first point that you have to see is a body constitution. In the constitution, first we have seen some of the different types. Now, One more is on the basis of the anthropometric measurement or classification of the child, three types of the humans are usually seen. So one is endomorph, another one is mesomorph, and another one is ectomorph. These are almost all in line with the germ layers, okay, in the fetal life. What do you mean by endomorph body constitution? Endomorph body constitution means the person is very soft, child is soft, round counters of the body, well developed cutaneous tissues. Okay, again almost all same with the kapha. Mesomorph is wide, stocky and muscular, whereas ectomorph is long, narrow hands, long feet, shallow thorax and also small waist. The properties are matching with the Vataja person. Okay, so this is based on the anthropometric measurements. We usually go for this endomorph, mesomorph and ectomorph. So now when you are looking into the clinical examination, in the general examination, the first point what you have to understand is the patient that you are attending, child that you are attending, which type of body constitution he is. Okay, is asthenic type, hypoasthenic type or hyperasthenic type or athletic type, endocrinal type. So like that you have first identify, because that is quite normal to that particular personality. We should not treat it as pathology. Although it's a hypoasthenic and he is healthy and it is normal, its body structure is like that only. That's called as constitution. Okay, and so this is the first step in the general examination that we have discussed. In the next class we will going to discuss about the stature, body stature. The second point in the general examination is body stature, so that we will discuss in the next class. Thank you.